I am sitting in the Oval Office with a pen in hand waiting for our senators to give it to me. For years, they've been talking about repeal, replace, repeal, replace. I think they passed it 61 times, repeal and replace. But that didn't mean anything because you had the minority, the Republicans. They didn't have the majority, so it wasn't going to get to the president. But if it ever did, Obama wasn't going to sign it.
Joining us now, member of the Democratic Leadership, Independent Senator Bernie Sanders of Vermont. It's so great to have you back on the show.
Great to be with you.
He's not ruling out 2020.
Okay, well, very good.
He's not ruling out 2020.
Let's talk about 2017. Where do we find ourselves? In Washington, D.C. in July of 2017?
I think at a frightening place, in a place where people all over this country are scratching their heads. They're incredibly worried about the temperament of this president. I don't have to tell you anything about that. But what we should not also ignore, it's not just his temperament and it's not just his stupid tweets. Do not forget for a second that the policies that he is proposing are the most destructive policies being proposed in our lifetimes. This legislation that he is urging Congress to pass would throw 23 million Americans off of health insurance. How many of those people will die, we don't know, but thousands of them will. That's what we're talking about. That's not me. That's a number of studies. This is legislation that would cut Medicaid by $800 billion. Last night I had a telephone conference, town meeting with 15,000 Vermonters. People are calling up. My kid has a very, very serious illness. We're spending a fortune on prescription drugs. What happens if Medicaid is cut? I don't know what I could tell them.
Let me ask you this question. Obviously, in Vermont, rural health care matters.
Yep.
In the states Donald Trump won, a lot of states I lived in, Georgia, Mississippi, Alabama, Florida, rural health care matters.
Yep.
Talk about how these cuts in Medicaid will actually disproportionately hurt many of the very people who voted for Donald Trump.
Joe, I have spent the last month going to Pennsylvania, to Kentucky, to West Virginia, to Ohio to make just that point. And the reason you have groups like the American Hospital Association, not the most progressive group in the world, opposing this legislation, they understand that if you make savage cuts to Medicaid, rural hospitals all over this country are going to disappear. Where do people then go to get the care that they desperately need? He's talking about taking away, Republicans talk about rights and freedom and choice. 2.5 million women have chosen Planned Parenthood as their source of health care. That's gone. Older workers. Trump did very well with older working class people. You're an older worker making $40,000 a year, you're 60 years of age, your premiums in some cases will more than double.
What happens to nursing homes?
Thank you for raising that issue because it's not talked about enough.
My mother, my mother's in a nursing home right now, and I look at the people that are around her. I know for them, Medicaid is a lifeline, not only for them, but for their families. Two-thirds of nursing home care is paid for by Medicaid. So somebody's mom is there with Alzheimer's, you don't have a lot of money. Maybe you have a kid with a severe disability. What happens? And then on top of all of this, I mean, and this is almost, when you say it, people don't believe you, but it is true. They want to give $500 billion in tax breaks, $200 billion to the wealthiest 2%, more tax breaks for insurance companies and drug companies. See, here you have a nation where you're throwing 22 million people, 23 million people off of health insurance to give tax breaks to billionaires. That is why, in the last poll that I have seen, 12% of the American people support this absurd legislation, and that is why the AMA, the American Hospital Association, the AARP, every major healthcare organization in this country opposes this disastrous bill. And that is why the Republicans have not held one public hearing on this. They don't have the guts to go forward, hear from the doctors and the nurses. Mark.
What's your optimistic scenario for the rest of the year of what Washington might do?
I hope we beat this thing. I hope we beat this thing badly. I hope that Trump supporters in rural states understand that what he told them during the campaign, that he was going to stand up for working class people, was nothing but a lie. And if you think this health care bill is a disaster, take a look at the budget that he proposed. $3 trillion in tax breaks for the top 1%, massive cuts in education, in health care, in all of the programs that working families need. He has got to be exposed for the fraud that he is, not just focusing on his temperament and on his tweets, but on this extremely right-wing policy that is paid for by the Koch brothers and other billionaires.
What is it that the Trump supporter is drawn to at this point if they look at the policies and how it impacts their lives? Because he has his base. It's there.
He has its base, but I think, Mika, that base is shrinking the more people learn about his policies. But the base is that he ran an effective campaign and he said, you know, I'm going to take on the establishment and I'm going to stand up for the working class of this country that has so long been ignored. And in my view, the Democratic Party has not done a good job in standing up for the working class of this country. And I think he captured that sentiment pretty effectively.
Where did the Democratic Party go wrong?
Well, for the last many, many years, the Democratic Party has been spending too much money, too much time raising money from its wealthy friends, turning its back on rural America, turning its back on the working class, talking about deregulating Wall Street, talking about not paying attention to the needs of people whose standard of living has been in decline. Now, Obama, in my view, did a reasonable job. We were better off after his 8 years economically than we were when he came in. But the fact of the matter is, for 40 years, the middle class of this country has been in decline. We're looking at massive levels of income and wealth inequality. 52% of all new income today is going to the top 1%. All right, you have large multinational corporations making billions, not paying a nickel in taxes. The average American understands that. Working 2 or 3 jobs, all of the wealth and income's going to the people on top. Who's talking to their needs? Who's going to Kentucky and Mississippi and Alabama and saying, we're going to stand with you, we're prepared to take on corporate America and Wall Street and the big money?
Well, I was going to ask, you're, as far as I can tell, the only senator who caucuses with the Democrats who's actually gone outside of D.C. to states that aren't his or her own to talk to voters about health care in their communities. You mentioned West Virginia, Kentucky, Ohio, Iowa, so on and so forth.
Pennsylvania.
2 questions for you. One is, should your colleagues be doing the same? And then the second question is it odd for you because you are not a notable defender of Obamacare and that you want single payer, and yet here you are, the public face almost of the party's defense of Obamacare.
Of course, it's not odd for me. That's what my job is. My job is to go to a state like Kentucky, and this is the great irony of this whole thing. Do you know what state in America benefited the most from the Affordable Care Act?
It's Kentucky.
Do you know what state saw a significant decline in the number of uninsured from 20% to 7-8%? Only 4% of their kids in Kentucky now are uninsured. They have made real progress. How do you have a United States senator representing a state that has done extraordinarily well saying, I'm going to throw 230,000 people in my own state off of health insurance? But all over this country, people feel helpless, they feel powerless.
And scared.
They're scared, they don't know what to do. So what I think we have got to do is remake American democracy. I go out there and I say, you know what, you have the power. Stand up, fight back, organize. And we're beginning to see this all over the country. But those are exactly the states that need to be visited. That's exactly the people who need to be reinvigorated to understand what American democracy is about.
Does the rest of the Democratic Party get that? Do your friends in the Senate get that in the Democratic caucus?
I'll let you guys answer that better than I mean, I think clearly there are differences of opinion as to how we go
Do
forward.
there need to be new organizations to bring this about, or simply the DNC and grassroots?
I think we need major efforts in building grassroots organizations. One thing I will tell you, having gone to many of these states, there are extraordinary people out there. It blew my mind. We went to West Virginia. This guy gets up there, young man, maybe 30 years of age. His name is Rusty. And he talks about his struggle with testicular cancer, life and death struggle. This guy is so articulate, such a beautiful guy. There are people like that all over this country. You know, when media sometimes say we're a divided country, in many respects, we are not divided. When only 12% of the American people support ugly legislation that would do what this legislation would do, we're not divided. The American people want to raise the minimum wage. They want to rebuild our infrastructure. They want the wealthy not to have more tax breaks, but to start paying their fair share of taxes. And I think we've just got to go out to those people and bring them together. Democrats have ignored them for too long.
Senator Bernie Sanders, thank you. It's always great to have you on the show.
Great to be
Thank
with
you
you,
very
Bernie.
much.
Yep.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.